Now we are going to discuss about the mid-palmar space. So mid-palmar space, first of all, we need to know about the parts. Okay, here you can see these are the triangles are called metacarpal bones. This is the lettermost 1, 2, 3, 4, 5, and connecting them is the dorsal interosseous between muscles, and these are palmar interosseous. These cone-shaped muscles are palmar interosseous. Third, metacarpal do not have palmar interosseous. Now these all muscles are covered by a fascia. Okay, and the thenar muscles is also covered by a fascia. Hypothenar muscles are also covered by a fascia, and this entire apparatus is covered by the skin. And this is also one fascia covering the tendons of the flexor tendons. And between these two is the palmar aponeurosis. This is the palmar aponeurosis. These are superficial tendons. These are deep tendons, means profundus tendons. Okay, now this is the intermediate septum. This is the medial septum. This is the lateral septum. This is the intermediate medial septum. Okay, now the space between the flexor tendons and the fascia covering the metacarpals and these muscles is called mid-palmar space. Okay, this is called mid-palmar space. It is covered anteriorly by the 2, 3, 4 flexor tendons, flexor profundus tendons, and 2, 3, 4 flexor superficial tendons, and palmar aponeurosis and skins, like that. And it is covered posteriorly by the dorsal interosseous muscles and palmar interosseous muscles and the metacarpals. Okay, it is surrounded laterally, medially by the medial septum and laterally by the intermediate septum, I can say. And this is all about the medial palmar space. And here the infection spread through the ulnar bursa or radial bursa, and it has an outlet, means through which we remove the pus from medial, from third and fourth web space, I can say. Okay, from here we will remove the pus formed in the mid-palmar space. Okay, now that's it for mid-palmar space. Now we are going to discuss about the thenar space. Thenar space is located below the flexor tendons and adductor pollicis muscle. This is the thenar space, and between these flexor distal profundus tendons there are lumbricals. In this way, lumbrical muscles are present. Okay, and this thenar space is surrounded medially by the medial palmar septum and laterally by the lateral palmar septum, and posteriorly by the adductor pollicis brevis muscle, and this dorsal interosseous muscle and palmar interosseous muscles, and superiorly by the palmar aponeurosis and skin folds. Okay, for this infection occurs via the radial bursa or from the synovial sheath of index finger. Okay, and the pus formed is drained via web space of the thumb, like this space. From this space the pus formed is drained. Okay, that's it. Radial bursa, it is nothing but the synovial sheath of FPL tendon, flexor pollicis longus tendon, and it extends from the web space of thumb to the proximally 2.5 centimeters above the flexor retinaculum. Okay, now up to there means this is the flexor retinaculum, and 2.5 centimeters above means like this, and from the web space of the thumb means from here to this is the okay. Now it is drained from the medial margin of thenar eminence. Okay, that's it. Now we are going to discuss about the foramen space of Parona. It extends from the pronator quadratus, means this is the pronator quadratus and this is the flexor retinaculum, to the oblique margin of the flexor digitorum profundus. This entire is the foramen space of Parona. And if we do cross section here, we will find like this. This is the ulna, this is the radius. You can see on the medial side there will be ulna, on the radial side there will be radius. This is the pronator quadratus, and this is the flexor digitorum superficialis, and this is the tendons of the flexor digitorum profundus. 1, 2, 3, 4, and the space between the flexor tendons and the pronator quadratus, this is called foramen space of Parona. Okay, this is called foramen space of Parona. Its infection occurs via ulnar bursa, and it can be removed or drained out by making incisions on the distal part of the foramen, like here on distal part of the foramen. Means I can say this way. Here I am unable to show my pen on the lateral sides of the foramen. 1 minute, I will try to show. Yeah, means here I can make incision, and on the in the similar way I can make here also incision. Means here lateral side and here lateral side, medial side and lateral side. Distal foramen means this is the distal foramen, this, and in front of it will become the proximal foramen. Okay. Ulnar bursa is nothing but the synovial sheath of flexor digitorum profundus and the flexor digitorum superficial tendons. This will extend to form ulnar bursa. Okay, and it is extended proximally up to 2.5 centimeters above flexor retinaculum, and distally up to mid shaft of metacarpals, and medially it matches with the synovial sheath of the little finger. Okay, and we will drain the pus via radial incision on the hypothenar eminence, as I am showing in the video. This is the radial margin of the hypothenar eminence. Okay, and this is all about the ulnar bursa. Now we are going to discuss about the pulp space of fingers. And you can see this is the nail bed, and this is the terminal phalanx or distal phalanx, and this is the 4/5 and this is the 1/5 part of the distal phalanx. Now what is the pulp space? This is the fibrous septum. Now these spaces is called pulp spaces, and it will extend up to the 4/5 of the terminal phalanx, and from here you will get arteries, digital arteries. This will pierce these fibrous septus and supply blood to this terminal phalanx. Periosteum will be there here, and it will supply blood like this. Now if by somehow here there is an infection, and then it will lead to the occlusion of the or blockage of the digital artery, isn't it? No, it will lead to the necrosis of whole this part if we will not treat this infection means. So we should treat, otherwise we will get necrosis. In order to prevent this, we will do surgery and we will remove. Okay. Now here there will be a branch from the digital artery. It does not pierce the fibrous septa, therefore it is not affected and it will not undergo necrosis. Okay, and this is the pulp space, and the infection here is called Whitelow. The name given here is Whitelow for the infection, and The pain, the type of pain we get here is throbbing pain, means pulsating pain. Throbbing pain, that is a pulsating pain we'll get here. Okay. Tension, because of tension we get this throbbing pain, means pus will form and it will become swollen and get tense, very tense, means very extended, stretched, and that leads to the throbbing pain. Okay, this is about the pulp space of the finger.